The most important indication of China is periodicity, as evidenced by the periodic attacks of schizophrenia, fever, or the periodic attack of diarrhea or headache. The China children are introverted, intense, touchy, moody, and very idealistic. Right from a very young age, their idealistic and committed behavior becomes very apparent. They believe in having certain commitments which may be to their parents, to their religion, or to their country. Once they have set the pattern and plan, anything which hampers or opposes their thinking and ideals disturbs the patient to a great extent.
They expect other family members to live the kind of life envisaged by them, and failure of the family members to do so is enough to shake them from the roots. Like tarantula and medorinum, it is an important remedy for disobedience in children. They do not listen to or pay heed to their parents. China comes very close to tarantula in certain points, but China doesn't have violence, restlessness, and destructiveness of tarantula. This child has a highly evolved mind. He is not only very intelligent, but also very sensitive. He has a strong artistic aptitude and could easily be a poet or a painter. The hyperactive mind can have vivid imaginations and ideas of great glory and fantastic or heroic deeds. Such ideas crowd their mind all the time. They theorize, fantasize, and build castles in the air. They live in their own world where they do not want to be disturbed. There is a strong desire for solitude.
The China child has an aversion to being carried. Consolation aggravates, kind words aggravate. Another remedy, syphilinum.
Such is the level of their sensitivity. They are very touchy and take the minutest hurt to the heart immediately. Why you said that to me? A minor disturbance affects them so much that they brood for a long time, become sleepless and morose. The sensitivity is so high that they cannot even bear to be looked at. China gets easily disturbed by words of others. They keep on brooding upon events long past forgotten.
Too many thoughts crowd upon their mind, and as they are unable to arrange their thoughts, a state of confusion sets in very early. This confusion compounds further, and the child does not know what to do. He makes mistakes in speech and writing. He uses wrong words or reverses words, especially while writing. It is a very important remedy for schizophrenic response. They show the preliminary signs at a very early age. Here is an active, poetic, and intelligent individual who becomes gloomy, depressed, and unable to relate to the realities of life as a result of some minor disturbance or hindrance. He loses interest in studies, in business, and in day-to-day activities to such an extent that he gets delusions that he is hindered at work and that he is persecuted.
They feel gloomy, depressed, and want to commit suicide. But they do not have the courage to do so. They will just talk about it, but will never put it in action.
During depression, they begin to believe that material and worldly objects like money are not worthwhile. They feel their life is meant for something better and bigger. They avoid routine work and then develop total disinclination to work. They survive on the earnings of others. You will find them running away from day-to-day problems and even the most simplest tasks in life.
They find it difficult to put anything into action due to the very weak willpower. Just as others have hurt him, they develop the inclination to hurt others' feelings as well. They can be very cruel and inhuman at this stage. Although they hurt and try to vex others, they feel guilty about such behavior and then brood about it. Oh, why did I do that? Oh, I shouldn't have done that. Oh.
He has a tremendous fear of animals, +3, and even domestic animals like dogs, etc. Prostration so much that he cannot even move. Patient feels dizzy while walking. The causative factors are loss of body fluids, suppression of emotions, mortification, thunderstorm, pleasant surprises, periodic headaches every day, every second day, every seventh day. Headache better by pressure, pressing the teeth together firmly, by lying and standing.
Cold sweat around the mouth. Taste bitter. Craving of sweets very intense. Aversion to hot food, fruits, fat, butter. Bloody leukorrhea. Asthma in fall. Flatulence. Gas passes from above and down with no relief. Gallbladder, colic. Diarrhea aggravated by fish, fruit and milk. Skin sensitive, painful during fever, sensitive to touch, but relieved by hard pressure.
Aggravations: milk, fruit, draught of air, laughing, noise, odors, light, touch, pain, foggy damp weather, and draught of air. Ameliorations: bending double, hard pressure, loose clothes, warmth, when occupied. Sphere of action: intestines, head, liver and extremities. Clinical: migraine, neuralgia, and post-operative complications. Baja: it is an important remedy for malarial kind of fever. Malarial fever can be treated and brought under control immediately.